Cinnamon is safe during pregnancy when taken in controlled amounts. For instance, you can use cinnamon as a flavoring agent to your beverage or dessert. But if you are adding it too much to your recipes or taking a high amount of cinnamon bark or cinnamon oil, it could lead to some adverse effects. Here we can see what cinnamon in less quantity can do in pregnancy. Number one, gestational diabetes. Certain studies have shown that cinnamon could potentially reduce the insulin requirements for women with gestational diabetes. However, this subject is still under clinical trials and need further research to validate the claim. Number two, blood pressure. High blood pressure or hypertension during pregnancy is not uncommon unless there are medical conditions causing fluctuation in blood pressure. It is fairly manageable. Cinnamon has some favorable effects on lowering the blood pressure, provided it is taken in a limited amount. Number 3, nausea. Nausea and vomiting are the most common symptoms of pregnancy. Cinnamon used in certain formulations may have some relieving effects on these issues. As cinnamon is an approved treatment, there is not a set dose. Some experts suggest 2 to 4 grams of powder a day. Some studies have used between 1 and 6 grams of cinnamon. Very high dose might be toxic. Although cinnamon is known for its antibacterial and anti-inflammatory properties, a few studies do not recommend it for expecting mothers. Side effects of cinnamon during pregnancy. Cinnamon, when taken in high doses, works as an immunogogue and can potentially increase the risk of uterine contractions and premature labor. If you are taking antibiotics or any medications for medical conditions such as diabetes or heart ailments, then avoid cinnamon as it's known to have a blood thinning effect. This might result in excessive bleeding.